Health Minister Dr. Kwaku Agyemang Mensah says the government is putting the necessary measures in place to prevent Ebola from entering the country. He has therefore asked the public to adhere to the preventive measures in the various media and report any suspected signs or symptoms to the nearest health facility. Dr. Agyemang Mensah was in Koforidua to check the Eastern region's level of preparedness to deal with the disease if it should occur.
The health minister was accompanied by the Director General of the Ghana Health Services and some health personnel from the regional directorate. The Eastern Regional Minister, Mr. Setre, briefed the health minister on what preparations have been put in place in the eventuality that the disease rears its head in the region.
The health personnel are really ready with the support of the Regional Coordinating Council and all other stakeholders to ensure that when it comes, the necessary things that must be done will be done.
Answering questions from the media, the director of the GHS, Dr. Ebenezer Piadintra, explained the screening process of people into the country.
There's this thermometer which doesn't touch. We don't need to touch you. It shows an increase in temperature, even if you say that I don't have fever. And that's why we used to detect that people have or not. So if you are coming from an affected country, your temperature is high, straight away it will take you out of the line. And that's basically screening.
The health minister, Dr. Kwaku Agyemang Mensah, noted that a lot of measures are being put in place by the government to prevent Ebola from entering the shores of Ghana.
At the entry points, all the entry points, when you enter, there's port health form that you have to fill. So they can use this, find out whether you are coming from an affected country, where you have been, your address, so that in case there is something, they can easily trace you. But they are doing what they call contact tracing. What we need is protective equipment. The government has made available 6 million Ghana cedis. We have placed an order for 10,000, but we've been told that at the initial stage we can only get 5,000.
The minister and his entourage later visited the Insaram Government Hospital to have first-hand information about their level of preparedness. He was conducted round some wards of the hospital before meeting staff of the hospital. The Insaram Maduajiri Municipal Director of Health, Mrs. Esther Dia Oyinka, said the municipality has recorded 231 cases of cholera. However, health workers are working tirelessly to control the disease. She said education is also ongoing to sensitize the public to observe good environmental hygiene to prevent contracting cholera. On Ebola, Mrs. Dua Oyinka noted that the hospital has purchased hand-washing system and sanitizers as part of its preventive measures. Health workers, she said, have also been given the needed education on how to stay safe when treating Ebola patients. The health minister was impressed about the measures put in place by the Nsawam Government Hospital and called for collaborative efforts to contain the disease.